get Miss Pat on the table. Now I want you to notice a couple of things. We have a table here that can be raised or lowered. We're also using contrasting sheets because many elderly clients are going to have visual disturbances, and so this is easier to see when you have contrasting sheets. This table also has the ability to lift the upper body, which she's going to need for ease of breathing with her asthma and with her reflux issues. And it also has the ability to raise the bottom for knee flexion, and that helps with any kind of lower back issues. So Ms. Pat, what I want you to do, we have it lowered. I want you to notice that you're about in the center of the table. When I leave, I want you to drop your robe, and I want you to back up until your legs are touching the edge of the table. And then I want you to flex and then sit down. And then when you're completely on the table, you can rotate your body. Your head's going to go up here. Notice how I'm tapping the table, and also so I'm gesturing, and she's hearing it. And then I'm using my feet, my hands as well. I want your feet to go on this end, and I'll make sure that I announce myself before I come back, okay? So let's go ahead and practice that first. Go ahead and have a seat and rotate. Wonderful. Now, when I come back, we'll get started. She'll be underneath the sheet, and we'll talk about the next set of adjustments. Now, Miss Pat is on the table. How are you feeling?
Just fine.
Great. Okay, the first thing I'm going to do is I'm going to use this neck pillow, and it's got a beveled corner, and her cervical vertebra is going to fit right here. But I want to cover it up for sanitation purposes first. So I'm going to wrap it with this cloth. And raise that for me, please, and come on down now. How does that feel?
Very comfortable.
Awesome, great. Okay, then I'm going to use the hand controls, and I'm going to elevate the table first to where I'm going to be most comfortable. And I may lower it later. We'll just see how it goes. And I want you to tell me, Ms. Pat, a good angle for this part right here. Higher or lower?
Probably a little lower, I believe.
Okay. We probably had it perfect the first time, didn't we?
Felt good. That's pretty good.
Feels really good. Okay. Now we're going to work on the leg adjustments. Does it feel strange having the table move beneath you?
A little. Should have one at home to sleep on.
Oh, she wants one home to sleep on. How does that feel on the legs?
It's fine.
Okay. You comfortable?
Yes.
Okay, great. Okay, now before we got started, we did offer Miss Pat some water, which she drank. Now I'm going to ask her to hand me her glasses. Thank you so much. And I'm going to move these over here. I will get them again later. Now, you want to be sure and hand these back to her before she gets up off the table and gets dressed. And we're going to go ahead and get started. And you're not allergic to any kind of topical agents, correct?
No.
Okay, great. Now, remember, this is your massage. If I'm doing anything that's making you uncomfortable, if you're hurting, if you want a position to change, you just let me know, okay?
Fine.
Great. I'm going to start with your neck. Now, because Ms. Pat has the issues, I'm going to take this away just for a second. No, go ahead and drop back down for me. There you go. Okay. Because Ms. Pat has issues with her neck, we can do massage on it, but we can't do mobilizations of her vertebra. Elderly clients in massage. Why is massage different? When you're working with elderly clients, be sure to modify your massage for the elderly. You must take into account their health status and any limitations that they may have. You must take into account the aging process and the effects it has on their body. You must also take into account any social and emotional needs, as well as any financial restrictions. By 2020, 17% of the population will be 65 years or older. This population presents us with some very unique challenges. There are physical changes. Some of these are thinning skin, reduced muscle mass. Over 52% of elderly clients will have either vision or hearing impairments or both, and more than 90% of elderly use medicines to control medical conditions, and their side effects must be taken into consideration. This population also has lifestyle and emotional changes. They may be experiencing loss of loved ones. Most are retired and may be dealing with reduced incomes. But it's important to point out that there are no typical 70-year-olds. They can be quite active and independent. However, some do require assistance and may be at home or in assisted living facilities. And some elderly are frail and live in skilled care facilities or at home with family or caregivers. So how does all this relate to massage? 65 years old is when we must start taking into account the aging process and how it might affect massage. As we age, there are some normal changes that occur in joints and blood vessels as well as the brain. When these cause health problems, they're called diseases. Examples of diseases that occur in the elderly are arthritis, high blood pressure, and Alzheimer's disease. Now, we can group aging into 3 categories. We can look at those 55 to 64 as older adults, 65 to 74 as the elderly, and 75 to 85 as aged, and then people 85 years old and older as extremely aged. Next, we're going to be looking at some specific physical effects of aging. We'll talk about skin, respiratory and cardiovascular system changes, changes in the gastrointestinal tract, musculoskeletal systems, and the nervous system, and how these can contribute to both impairments and disabilities. First, let's look at the skin. As we age, our skin begins to wrinkle and sag. There is reduced elasticity. The skin becomes more thin and frail. It may tear more easily. It also heals more slowly. There is a decrease in what's called subcutaneous fat. This is fat that's right underneath the skin. You also have an increased incidence of bruising from reduced support of blood vessels, because this fat also supports the blood vessels, and there is a reduced temperature regulation of the skin. In the respiratory system, the ribs may calcify, and this would lead to chest wall rigidity, which also reduces thoracic movements. And in most elderly, there's also a decreased capacity for lung volume. In the aging in regards to the cardiovascular system, the heart often enlarges. Vascular walls may thicken and narrow. There's often an increase in blood pressure. The circulation actually decreases. The person may fatigue more easily, which may lead to dizzy spells. And the dizzy spells also contribute to something called orthostatic hypotension. This would also contribute to dizzy spells. There's also increased varicosities in blood clot formation in the legs. This is especially true with their sedentary clients. Gastrointestinal changes include decreased gastric secretions, slowed digestion. There's an increased incidence of heartburn, or what's called GERD. There's decreased tone of sphincter muscles, and the client may be suffering from fecal incontinence. In the musculoskeletal system, there is often decreased muscle mass, decreased bone mass, decreased strength, reduced flexibility. Your client may be dealing with altered gait. Articular cartilage in the joints begin to erode. The synovial fluid production may decrease. Discs may become more dehydrated and also narrow. And there is often osteoporosis in women and osteoarthritis and kyphosis in both men and women. The next are neurologic changes. This includes decreased cerebral blood flow, nerve degeneration, reduced response time, a loss or increased sensitivity to pain, decreased cold tolerance, decreased balance and coordination, as well as altered gait. Your client also maybe dealing with some sensory changes, and these include your pupils may decrease in size, there's decreased cataracts, the walls of the auditory canals may change, and the eardrums thicken, and these incidents may cause visual impairments, which are common, and hearing impairments, which are also common. And the last thing we're going to discuss is the urinary system, and oftentimes there's a decreased bladder capacity, incomplete bladder emptying, which may lead to more urinary urgency. There's also a decrease in the tone of sphincter muscles, which may lead to urinary incontinence. When you're working with an elderly client, 65 and older, you want to take special care to evaluate their health status. 90% of elderly have a chronic illness. Be sure also to inquire about medications and ascertain any special needs or concerns that they have and be able to modify your massage accordingly. Commonly used medications are cardiovascular agents such as anticoagulants, vasodilators, antiarrhythmics, ACE inhibitors, beta blockers, diuretics, and medications used to lower blood cholesterol levels. Common side effects of these medication includes bruising that may occur easily, orthostatic hypotension, which may lead to dizzy spells, severe or persistent muscle or joint pain. This is a common side effect and actually a very severe side effect of things like statin drugs and drugs that lower your blood cholesterol levels. Anytime your elderly client does complain persistent or severe muscle weakness or joint pain, it's important that they seek medical attention immediately. Another side effect of these medications is frequent urination. This is actually considered a therapeutic effect, not a side effect, but you need to factor this into your treatment plan as well. Very early in the session, you need to decide if your client is robust or frail. And oftentimes, you can just ask them about their physical activity level, if they exercise regularly and they do not have a disease that they're dealing with, they can receive a more vigorous massage. If they're more frail, you may need to go more gently, more slowly, and have a shorter session time. Some general massage guidelines for your elderly client that are very important is you need to be flexible with your scheduling times. Most elderly do not like to be outside past dark, so be sure that you schedule your appointment during daylight hours. They also may need assistance with the intake form. You may want to take it from them and ask them questions while you write down the responses on the sheet. Be sure to position your client for safety. This usually means lowering your table to make sure they can get on safely, having unobstructed human passage, also to limit or avoid the prone position because it's more difficult to breathe in the prone position. If they're in the supine position, be sure you elevate their upper body. And limit the times that they change position to 1 or 2. If you can't get them on the massage table for whatever reason, you definitely can massage them in their bed or on a sofa if you're massaging them at home, but the floor is not an option. You also want to consider reduced pressure. This is also the downward force and also the amount of sliding you do across the skin because we are dealing with skin that can tear in the cases of the frail elderly client. You want to limit your stretches and joint mobilizations to just gentle stretching and rocking movements. You want to avoid any extreme spinal mobilization. This includes the neck, especially in cases of osteoporosis and osteoarthritis, which many elderly people have. If your client is frail, you want to consider doing a shorter session. This may include 5 minutes of unhurried effleurage and deep breathing and gentle rocking, 20 minutes of focused work either on the feet, the legs, the back, the shoulders, and the neck, and your client will determine where the focus work needs to be. And then 5 minutes of closure work. Now, it's very common for an elderly client to have feet problems. So before you massage the feet, you want to be sure and inspect the feet. This means that if your client is wearing socks or slippers, you must obtain permission before removing them. And then be sure and replace them when you're finished. Be sure and avoid any unhealthy or suspicious looking areas. This includes the nails. And bring them to the attention of either the client and or the caregiver. Also respect their wishes to leave their socks on. You also want to guard against chilling. This may include the use of a blanket. Even when the client is clothed, you want to use a blanket or a sheet over the client. Table heating pads are a great idea. Just be sure you turn them off when your client gets on the table, so have them turned on about 30 minutes before you get started. The most common safety issue for people 65 and older is falling. So you need to do whatever you can to keep the client safe. And medications can alter balance and coordination and response time. And remember, orthostatic hypotension is common. If you remove eyewear from the client before you get started, be sure to replace them before you leave the room. And it's real important that because of the visual impairments, that you consider using table fabrics that contrast with each other, and perhaps they can contrast also with the wall and the floor colors. Before you leave the massage room, be sure to remind the client to sit up for a moment before standing, to move slowly rather than quickly, and to be able to help them if they need assistance. You must be patient and reverent with your elderly clients. Respect their slower pace rather than maximizing massage time. Be sure to allow extra time for the clients to undress, which is oftentimes layers and layers of clothing. Also, provide a transition time after the massage to hear a story or for them to express their concerns. Some elderly clients need to cry, to complain, or to convey fears. Make sure you provide some massage time for this as well. Research indicates that a social connection is key to health and happiness in the elderly. An ongoing relationship and focused attention from you, the therapist, can be a significant part of the life of the elderly.